Let's discuss stroke, also known as a cerebrovascular accident, CVA. It's a critical medical emergency that occurs when blood flow to the brain is interrupted, leading to potential brain damage. Understanding the different types of strokes, their causes, symptoms, and treatments is essential. What is a stroke? A stroke occurs when the blood supply to part of the brain is suddenly cut off or severely reduced. This deprives brain tissue of oxygen and nutrients, causing brain cells to die within minutes. Strokes are a leading cause of disability and death worldwide. 2. Types of strokes. There are primarily two main categories of stroke. 1. Ischemic stroke, 87% of all strokes. Cause. An ischemic stroke occurs when a blood clot or other blockage obstructs a blood vessel in the brain, reducing or cutting off blood flow. Types. Thrombotic stroke. A blood clot, thrombus, forms within a cerebral artery, usually due to atherosclerosis, plaque buildup in arteries. Embolic stroke. A blood clot, embolus, or other debris, such as a fat or air bubble, forms elsewhere in the body, often in the heart, and travels through the bloodstream to lodge in a cerebral artery, blocking blood flow. Lacunar stroke occurs due to a blockage of small, deep penetrating arteries in the brain, often related to hypertension. 2. Hemorrhagic stroke, 13% of all strokes. Cause. A hemorrhagic stroke occurs when a blood vessel in the brain ruptures, causing bleeding into the brain tissue or into the space surrounding the brain. Types. Intracerebral hemorrhage, bleeding directly into the brain tissue, often due to high blood pressure or an aneurysm, weakened area of a blood vessel. Subarachnoid hemorrhage, bleeding into the subarachnoid space, the space between the brain and the arachnoid membrane, often due to a ruptured aneurysm or arteriovenous malformation, AVM. 3. Transient ischemic attack, TIA, a warning sign. 1. Definition. A TIA, often called a mini-stroke, is a brief episode of stroke-like symptoms that resolves completely within minutes to hours, usually less than 24 hours, without causing permanent brain damage. 2. Cause. TIAs are caused by a temporary blockage of blood flow to the brain. 3. Importance. A TIA is a significant warning sign that a full-blown stroke may occur soon. 3. Seeking immediate medical attention after a TIA is crucial to prevent a future stroke. IV. Risk factors for stroke. Several modifiable and non-modifiable risk factors can increase the likelihood of a stroke. 1. Modifiable risk factors, factors that can be changed. Hypertension, high blood pressure, the most significant risk factor for both ischemic and hemorrhagic stroke. High cholesterol can lead to atherosclerosis and blood clots. Smoking damages blood vessels and increases the risk of blood clots. Diabetes increases the risk of atherosclerosis and blood vessel damage. Obesity increases the risk of high blood pressure, diabetes, and high cholesterol. Physical inactivity contributes to obesity, high blood pressure, and diabetes. Poor diet, high in saturated and trans fats, sodium, and processed foods. Excessive alcohol consumption can increase blood pressure and contribute to heart problems. Atrial fibrillation, AFib, an irregular heart rhythm can cause blood clots that can travel to the brain. Carotid artery disease, narrowing or blockage of the carotid arteries in the neck. Sickle cell disease increases the risk of blood clots. 2. Non-modifiable risk factors, factors that cannot be changed. Age, the risk of stroke increases with age. Family history, having a family history of stroke increases the risk. Race, ethnicity, certain racial and ethnic groups have a higher risk. Sex, men are at slightly higher risk than women, although women are at greater risk later in life. Prior stroke or TIA increases the risk of a future stroke. Versus signs and symptoms of stroke, the symptoms of a stroke vary depending on the affected area of the brain. It's essential to recognize the symptoms immediately, as prompt medical intervention can minimize long-term damage. The acronym FAST is often used to remember the key signs. 1. Face. Facial drooping, especially on one side. 1. Ask the person to smile and observe for asymmetry. 2. Arms. Weakness or numbness in one arm. 2. Ask the person to raise both arms and observe for one drifting downward. 3. Speech. Difficulty speaking, slurred speech, or difficulty understanding speech. 4. Time: if any of the symptoms are present, it's time to call for emergency medical help immediately. Other potential symptoms can include 1. Sudden severe headache. 2. Dizziness or loss of balance. 3. Sudden vision problems, blurred or double vision, or loss of vision. 4. Confusion or disorientation. 5. Difficulty swallowing. 6. Numbness or weakness on one side of the body. 7. Changes in personality or mood. Diagnosis of stroke. Prompt diagnosis is crucial to initiate appropriate treatment. The diagnostic process includes 1. Physical examination, neurological exam to assess reflexes, muscle strength, sensation, and coordination. 2. Imaging studies, CT scan, computed tomography, typically the first imaging test done to quickly distinguish between ischemic and hemorrhagic stroke. MRI, magnetic resonance imaging, more detailed imaging that can detect subtle changes in the brain. Angiography can be used to visualize blood vessels in the brain and neck. 3. Blood tests, to check for blood clotting abnormalities and other factors. 4. ECG, electrocardiogram, to check for heart rhythm problems like atrial fibrillation. 7. Treatment of stroke. Treatment goals are to restore blood flow to the brain as quickly as possible and prevent future strokes. Treatment strategies vary depending on the type of stroke. 1. Ischemic stroke treatment, thrombolytic therapy, TPA, intravenous medication given to dissolve blood clots. Most effective if given within 4.5 hours of symptom onset. Mechanical thrombectomy, a procedure using a catheter to physically remove a blood clot from a cerebral artery. Effective in certain cases if performed within a specific time frame. Antiplatelet agents, aspirin or other antiplatelet drugs to help prevent further clots. Anticoagulants may be used to prevent future clots in high-risk patients. 2. Hemorrhagic stroke treatment, controlling bleeding, medications and interventions to lower blood pressure and stabilize blood clotting. Surgical intervention may be needed to repair damaged blood vessels or remove blood clots in the brain. Observation and supportive care, closely monitoring blood pressure and neurological status. 8. Rehabilitation after stroke. Rehabilitation is an important part of recovery and can help minimize long-term disability. Rehabilitation may include 1. Physical therapy, to improve strength, balance, coordination, and mobility. 2. Occupational therapy, to help with activities of daily living, adults. 3. Speech therapy, to improve speech, language, and swallowing difficulties. 4. Psychological counseling, to help patients cope with the emotional effects of a stroke. X. Prevention of stroke. Preventive measures are critical to reduce stroke risk. 1. Control blood pressure, through lifestyle changes and/or medication. 2. Lower cholesterol, through diet, exercise, and/or medication. 3. Stop smoking. Quitting smoking is essential for overall health and stroke prevention. 4. Manage diabetes, through diet, exercise, and/or medication. 5. Healthy diet, following a heart-healthy diet low in saturated fat and sodium, high in fruits and vegetables. 6. Regular exercise, engaging in at least 30 minutes of moderate intensity exercise most days of the week. 7. Maintain a healthy weight, through a healthy diet and exercise. 8. Limit alcohol consumption, or avoid alcohol altogether. 9. Treat atrial fibrillation, with medications or other interventions. In summary, stroke, a serious medical emergency, occurs when blood flow to the brain is interrupted, leading to potential brain damage. Recognizing the signs and symptoms of a stroke and seeking prompt medical attention is crucial for reducing long-term disability and death. Prevention through lifestyle changes and management of risk factors are key to reducing stroke risk.